Pugarmadi from the Department of Biomedical Engineering. Today I will be presenting my seminar on sensorineural hearing loss, mechanism and diagnosis. This topic is important because sensorineural hearing loss is the most common type of permanent hearing impairment, and understanding it helps us improve early detection and patient care. First we see about the introduction. Sensorineural hearing loss or SNHL occurs when the inner ear, especially the cochlea or the auditory nerve pathways, are damaged. Unlike other types of hearing loss, SNHL usually affect the clarity of speech more than loudness. This condition is mostly permanent, which is why early diagnosis is extremely important. People of any age can experience SNHL, and if not identified early, it can affect communication and quality of life. Next, normal hearing mechanism. To understand hearing loss, we must first understand how normal hearing works. Sound waves enter the ear canal and make the eardrum vibrate. These vibrations are carried by the three small bones in the middle ear, the ossicles, which amplifies the sound. The sound then enters the cochlea, where tiny hair cells converts these vibrations into electrical signal. These signals travel through the auditory nerve to the brain, where we finally interpret them as sound. So, any damage to these hair cells or the nerve can disturb this whole process. Next, epidemiology and importance. Sensorineural hearing loss is extremely common, especially in older adults. Age-related hearing loss, known as presbycusis, is the most frequent cause in people above 60 years. Noise-induced hearing loss is the most preventable cause and is often seen in people exposed to the loud occupational or recreational sounds. In children, genetic factors and cognitive conditions are major contributors. Understanding these patterns helps us focus on prevention and early intervention. Next, mechanism of sensorineural damage. There are two major mechanisms responsible for SNHL: cochlear damage and neural damage. Cochlear damage usually involves the loss of inner or outer hair cells, damage to the stereovascularis, or problems in supporting cells. Neural damage refers to injury in auditory nerve or central auditory pathways. The most common cause is hair cell loss, which can happen due to aging, loud noise, infections, or exposure to toxic medications. Next, etiology. SNHL can be either congenital or acquired. Congenital causes include genetic mutations such as infections during pregnancy like rubella or cytomegalovirus. Acquired causes include long-term noise exposure, head injuries, and presbycusis. Some medications, especially aminoglycosides, cisplatin, and loop diuretics, can damage cochlear hair cells and are called ototoxic drugs. Infections such as meningitis or labyrinthitis can also cause severe hearing loss. Next, diagnostics test. Diagnosis of SNHL involves several important tests. Speech audiometry checks how well the patient understands speech sounds. People with SNHL often struggle with clarity even when the sound is loud. Auditory brainstem response or APR testing evaluates how sound signals travel along the auditory nerve and brainstem. MRI is done to rule out retrocochlear causes such as acoustic neuromas. Next, differential diagnosis. It is most important to differentiate sensorineural hearing loss from conductive and mixed hearing loss. Conductive hearing loss occurs due to problems in the outer or middle ear and shows an ear-bone gap on audiometry. Sensorineural loss shows no ear-bone gap, and the Weber test typically shifts towards the better ear. Mixed hearing loss has features of both types. Accurate diagnosis ensures proper management and better outcomes. Next, management approaches. Although SNHL is usually permanent, it can be managed effectively. Medical treatment is useful only when there is an underlying cause such as infection or autoimmune disease. Rehabilitation plays a major role. Hearing aids are recommended for mild to moderate hearing loss. Cochlear implants are used for severe to profound SNHL and can significantly improve communication. Preventive steps include protecting the ears from loud noise and avoiding unnecessary use of ototoxic medication. Next, prognosis and prevention. Sensorineural hearing loss is generally non-reversible. However, with timely diagnosis and proper rehabilitation, patients can experience much better communication and quality of life. Prevention is regular hearing screenings of at-risk individuals, using hearing protection in noisy environments, and genetic counseling for congenital causes are all important steps to reduce the risk. Thank you.